Everyone, this is Dr. Ahmad, and today we're going to start to dive deeper into the cranial meninges. In the previous slides, we have looked at the neuroanatomy and the basic overview of the cranial meninges. So in this presentation, we're going to learn in more details about the cranial meninges. The objectives here are to learn more detail about the dura mater, arachnoid mater, and the pia mater. We will also learn about the spaces between the meninges, both real and pathological. We will also learn the blood supply, and we'll also look into the nerve supply of the meninges. So the very first thing that we're going to remember is the dura mater. That's what we're going to learn today. The dura mater is the outermost layer of the meninges. It originates from the mesoderm, and it is further divided according to the area it is providing the cover for. So, for example, if it is covering the brain, then the dura mater is going to be bilaminar. But when it is covering the spinal cord, it's only going to be unilaminar, which means only one layer. And when it's covering the brain, it's going to be bilaminar, or it has two layers. So the two layers that is covering the dura mater are periosteal layer, which is the layer right under the skull and it's firmly attached to it, and then there is the meningeal layer, which is the layer above the arachnoid mater, and it is one of the two layers of the dura mater. So these layers are mostly fused except where they are separated, like dural venous sinuses or infolding. So let's look at the image on the top right. So in this image, you will see this green line. This green line right here is the two layers of the dura mater, as we just discussed. So when it's going down here, you look at the infoldings or one of the folds right here. So this is the skull bone. This is the superior sagittal sinus. So the periosteal layer is going to go above it, and the meningeal layer is going to go up downwards. So it's going to create this superior sagittal sinus, is one of the sinuses among all the dural venous sinuses. So there's multiple infoldings or reflections of the dura mater. These multiple foldings have different functions. So the very first one we're going to look at is the falx cerebri. So this is the dura mater uh, that actually separates both right and left cerebral hemispheres. So look at the image on the top right. So this is the cross section of the skull. So you see the skull bone over here and one of the hemispheres of the cerebrum. So falx cerebri actually covers one hemisphere and it separates the one hemisphere from the second one. The second reflections is the tentorium cerebelli. So tentorium cerebelli. So cerebelli means it's covering the cerebellum, and the name tentorium. So you just take a small heat over here. So you see tentorium. So it's a tent or the roof over the cerebellum. So if you look at the image down here, you see the one of the hemispheres of the cerebellum. So this superior structure right here is the roof or the tentorium cerebelli. It has more significance in the nerve supply, but we will discuss that later. The third one is the cerebelli. Just as the falx cerebelli actually separates both right and left cerebellum hemispheres. So look here in the image below. It is the posterior view of the head. So you see this one right here. This is the falx cerebri, and it is separating both right and the left cerebral hemispheres. This is the division between it. Over here, this line right here is the tentorium cerebelli, and below is the two hemispheres of the cerebellum, and they are divided by the falx cerebelli. The last one is the diaphragma celli. So this is the roof over the pituitary gland. So uh, this image on the bottom right, you see this green line. This is the dura mater again, and it is covering the pituitary gland itself. It's a roof over them. So there is an aperture in the dural foldings right here, and this will allow the stalk or the infundibulum of the pituitary gland to go above and attach or connect itself to the diencephalon. So what is the clinical relevance of it? The diaphragma celli is fairly tough and fibrous, so it provides resistance to the growth of any pituitary tumor. So if there's any tumor that is growing on pituitary gland, it can, but it's going to be very tough for it to actually grow superiorly because of this tough fibrous infolding. However, the pituitary gland tumor is going to be growing on the lateral side of this cavernous sinus. So one of the another clinical significance with the pituitary tumor that you can remember, that it can actually compress the optic nerve, causing the hemianopium for the patient. They have a problem in their visions. The next layer for the meninges is the arachnoid mater. It's a thin membrane in contrast to the dura mater, and it is the outer layer of the subarachnoid space. And subarachnoid space is the space between the arachnoid mater and the pia mater, and it originates from the arachnoid layer is originating from the neural crust. So there's two structural consideration here for the arachnoid mater. The very first one is the arachnoid granulation. So when the arachnoid mater extends into the venous channels between the periosteal dura mater and the meningeal dura mater, so these form the arachnoid granulation, and it helps moving the cerebrospinal fluid into the venous channel. So I'm going to go to the next slide to show you what I mean. So you see here, this is the arachnoid mater right here, and you see these infoldings of the arachnoid mater that goes between the periosteal layer and the meningeal layer of the dura mater. So again, we're going to look at the example of the superior sagittal sinus. So you see this arachnoid granulation going above, and it will help draining the cerebrospinal fluid. The second consideration for the arachnoid mater is the trabeculae, and these are the extensions of the arachnoid downwards to the pia mater, and it is a web-like strands that separates both arachnoid and the pia mater. And one more thing that you have to remember is the arachnoid mater is avascular, and it is held against the meningeal layer of the dura mater by the CSF pressure. It is not held just like that automatically, it is held against by the CSF pressure. So we're going to look in these images again. We already discussed the arachnoid granulation, but in the second image that you look at is again a cross section of the brain. So you see the dura mater on top, you see this black line, that's the arachnoid mater. So once when it has an unfolding like this, in both the periosteal and the meningeal layer of the dura mater, you see the superior sagittal sinus again just like this. So it will help drain the CSF over there. However, you see these web-like structures, these are the subarachnoid trabeculae, and below that it's the brain tissue, and the top one and the layer that is covering is the pia mater, which we are going to discuss next. So the third layer, or the innermost layer of the meninges, is the pia mater. It is the thinnest and the most delicate membrane, and it also originates from the neural crest. Just like the arachnoid mater, pia mater also originates from the neural crest, and it adheres to the brain and its contours, sulci, and the gyri. And when you visualize it, it confers as a shiny appearance to the brain surface. So now we're going to look into the spaces in the meninges. So they are broadly classified into the real space and the potential or the pathological space. So the real meningeal space, there is only one, and that is the subarachnoid space, and it is classified as the real one, and it is between the arachnoid mater and the pia mater. It originates from the choroid plexus, and this space holds the cerebrospinal fluid produced by the choroid plexus, and the major arteries run through the subarachnoid space. So this is something that you have to remember. The other two are the potential or the pathological spaces that are actually created by a pathological process. So these are mostly above or below the dura mater. So it says as epidural space and the subdural space. Epi means above, sub means below. So the epidural space is the space that can exist between the skull bone and the periosteal layer of the dura mater, and it contains the blood vessels and the fat, and it is a site of a blood collection in the case of an injury to the middle meningeal artery. This is very important from the clinical correlation. You have a patient that comes to the emergency department with a blow to the head, and you see the blood pooling somewhere. That is the arterial injury, then it's the epidural space. The second one is the subdural space. So this space can exist between the arachnoid mater and the meningeal layer of the dura mater, and it contains the bridging veins between the cerebral hemisphere and the dural venous sinuses. And this space typically exists only under pathological conditions such as with the subdural hematoma. So let's look at this image. So both of them are both of these pathological spaces are shown here. So you see once again one of the cross sections of the head right here. So another way that you can remember is through the alphabetical order. So this is the dura mater right here. Above is arterial blood, below is the venous blood. Epidural and subdural. So A above, V below. So arterial injury above, epidural space, subdural space. So these are both the pathological. So you see the dura mater is very okay here, but over here it's bad because there's a skull fracture, there's a blood pooling because there's an injury to the middle meningeal artery. Over here there's the venous blood that is collecting and compressing the brain structures over here. So the next, we are going to learn about the blood supply. So the arterial supply to the dura mater. It's very easy. The main blood supply to the dura mater is through the middle meningeal artery, which originates from the maxillary artery. The middle meningeal artery then enters the skull through the foramen spinosum, and once it enters the cranial cavity, it will travel between the skull itself and the dura mater, and it will groove around the inner surface of the skull. And it has two branches, anterior and posterior. The anterior branch is related to the terion, which is a thin area on the lateral side of the skull. So you look at this image, this is the lateral view of a skull. So you see this is the foramen spinosum, the middle meningeal artery. When it's originated from the maxillary artery, it's entering from the foramen spinosum, and then it divides into anterior branch and the posterior branch. The anterior branch, as we just discussed, it's actually much more closely related to the terion, which is the thin area of the skull. So this is the venous drainage of the dura mater. So there's two layers of the dura mater that run together throughout most of the skull. Where they separate, the gap between them is called the dural venous sinuses. These sinuses drain blood and CSF from the brain and empty into the internal jugular vein. Just remember that this is the slide is going to preset what we are going to learn later about these dural venous sinuses in much more details in the coming presentation. But over here, it's just a basic overview that I wanted to show you and have an idea in your mind. So now we're going to look at the nerve supply. The nerve supply is also fairly simple for the meninges. So most of the dura mater is supplied by the trigeminal nerve branches, and it can be referred to as the supratentorial structure. So you remember the tentorium cerebelli, the roof over the cerebellum? That is the division. I ask you to remember that. Tentorium cerebellum is very important. That is the sheet, that is the roof that actually covers, that dura mater layer covers the cerebellum from top. So any structure above it is called supratentorial structures, and those structures are going to be supplied or innervated by the branches of the trigeminal nerve. As you know, trigeminal nerve is cranial nerve number 5 that you see here, and below it is the infratentorial structure. So those are going to be supplied by the cervical spinal nerves C2 and C3. These are the dermatomes that you see. So over here is the infratentorial structures that are supplied by C2 and C3. So this is just a basic, very simple nerve supply. Supratentorial, cranial nerve 5, trigeminal nerve. Below infratentorial structures, below the tentorium cerebelli, it is supplied by cranial nerve numbers C2 and, sorry, not the cranial nerve, spinal nerve C2 and C3. So with this slide, we are going to end our presentation. Thank you so much for supporting, and I will see you soon with another presentation on the neuroanatomy.